September is PCOS Awareness Month. I sat down with an expert on what it is, what to look out for, and how it can be managed. Take a look.
So PCOS stands for polycystic ovarian syndrome. And it's really been called the silent epidemic because more and more people are being diagnosed with it or could be diagnosed with it, which could lead to a lot of different ways we can manage our fertility, manage our health in the long run. So I think there's just a lot more being known about something that was also traditionally a very catch-all phrase in terms of explaining why a lot of people had infertility issues, but there's a lot more we know about it. 1 in 10 people have PCOS today, so that's women of childbearing years. But really, honestly, experts think that it's a lot more than that. So bringing attention and awareness to what we should know about our bodies, what we should be looking for, and then go talk to our doctors and our medical providers about it. So there's some things that we know we can look for in terms of symptoms. But first, let me get into a little bit of the causes. So what happens in PCOS is the syndrome causes a hormone imbalance. And that hormone imbalance in our ovaries causes a couple of things. Production of androgens, which are male hormones. So I think traditionally people are aware of, okay, if I have a PCOS symptom, it's excess hair on my arms or excess hair on my face. And that's really kind of caused by that excess of the androgens or the male hormones. The second is it causes too much insulin. So we have an insulin resistance. So I think that's kind of what's bubbled up a lot of this research to date is really all of the news around insulin resistance and weight gain. And so that's a big part of it too. So 75% of patients actually have weight challenges and have just said, I've gained this weight, I can't get it off, I don't know why. And so there's more we know about that insulin resistance and what we can do to help our bodies with that. So that's really kind of what polycystic ovarian syndrome is, and generally. There's some things we can look out for in terms of symptoms. Irregular periods or non-existent periods, acne, miscarriages, hair loss, an abundance of hair on your face, your arms. So maybe you have excess hair. You gain weight and have a hard time losing it. That's a really big one. And maybe you have skin tags around your neck or your face. And really what the doctors look at is if you really have, there's a correlation between if you have 2 or more of those symptoms, and there's a good chance you have PCOS. And it's always a good opportunity to go talk to your doctor about it. And see if that needs to be explored further. Whether you're trying to have a baby or not, just anytime you're in your reproductive years, your reproductive health is a very empowering part of our overall health. So I would say, and here's the good news, right? Here's the good news is that PCOS can be managed, and it can be, and there's things we can do, right? So I would say lifestyle, like healthy eating, healthy diet is one. Exercise is two. It goes back to those same principles of healthy bodies, right? And then you look at supplementing. So there's certain nutrients that your body craves that will help manage the symptoms of PCOS. So we're talking vitamin D, folate, inositol is being used, and you should talk to your doctor about that. It's over the counter. It's not a medicine. There are prescribed medicines you can use. And then if you're trying to get pregnant, of course, talk to your doctor about that. But there are, you can go through IVF, you can go through some assisted fertility treatments that can help that. But really, when you're looking at PCOS, and you can manage those symptoms, it's just, healthy diet, healthy eating, exercise, keep your body healthy, make sure you're supplementing with the right nutrients that can help manage those systems and give you a better chance of living, a good, long, healthy life and being able to have a child if diagnosed with PCOS as well. Please, if you have any of those symptoms, I think that's the biggest thing we can take away is it sounds really big, polycystic ovarian syndrome, but really those symptoms you have are indicating something else is going on in your body. So whether or not you're ready to try and have a baby, or you're just, a woman in her 20s and you have those symptoms and you're just feeling like you needed to explore that further, talk to your doctor, because there is a good chance, because we're seeing that rise in kind of the diagnosis of PCOS, that there's a way forward and a protocol that can help you.